Where it really gets caught is down deep into that supinator. And you can see when we feel in that area, it's really tight. Bad right there. So what I do is I get my depth into there and my tension, and she's pronated, and then I bring her into supination. And that nerve is just sliding under there. Now, radial nerve is a little bit different. Radial nerve will present first with some lateral elbow pain. What happens is the radial nerve comes down through here. So a lot of times people will present with some pain in the tricep back through here, and they'll have lateral elbow pain. And where it can get caught is right in here in some of these extensor muscles. A lot of times the client will actually say that they get some numbness and tingling in the web of the hand. So radial nerve will present with some numbness and tingling down through there as well.